Hi, my name is Irene, and I'll be informing you about the usage of drugs and how it affects the body. The drugs I specifically researched were cocaine, meth, and heroin, which are all forms of illegal drugs. According to the National Institute on Drug Abuse, the recent numbers of users recorded in the United States was in 2013, and that number was set to 24.6 million users aged 12 and older. Some citizens may believe that drug abuse is one of the biggest problems in the United States, especially for the individuals that are 18 and older, and believe that we should inform the effects of drugs in order to minimize the number of users. For each of the drug, I will be talking about the statistics of users, such as the number of users has increased or decreased in the past couple of years, the effects the drug has on the body physically while using, and the withdrawals that come along with the drug. The first drug I'll be talking about is cocaine. Cocaine is classified as a stimulant drug, also called uppers, because it speeds up the nervous system and has the ability to make the user feel very awake. You can either snort it, inject it, or rub it into your gums. Cocaine increases the level of dopamine in our brains, and an increase in dopamine leads to a euphoric rush, which is a state a person experiences intense pleasure and happiness. Statistics show in 2012, nearly 15% of Americans aged 12 and older have used cocaine, according to the book named Abnormal Psychology in a Changing World by Jeffrey S. Neville. A few short-term effects cocaine has on the body physically are a sudden increase in blood pressure and acceleration of the heart, which can cause dangerous or even fatal irregular heart rhythms. Symptoms while high on cocaine can be headaches, nausea, convulsions, or in some cases, hallucinations. The withdrawals can depend on the individual, but the common symptoms that have been gathered can be depression, insomnia, increased appetite, and slowed thinking and movement. In the aspect of long-term effects, you can have permanent nasal damage, such as losing the sense of smell and having periodic nosebleeds. According to the National Institute on Drug Abuse, statistics show the users of cocaine has declined in the past couple of years, with 1.5 million users compared to the year of 2007, where the amount of users was ranging from 2 million to 2.4 million. Like cocaine, heroin is a drug also known for building up the dopamine in our brains. Although with the same initial effects of the increase in dopamine, heroin is considered an opiate drug, which are drugs that cause the body to be drowsy. Instead of accelerating the heart like cocaine, heroin actually decreases the heart rate and the breathing severely to the point where it can lead the body to a coma and can cause permanent brain damage. Aside from that, the effects can be warm flushing of skin, dry mouth, and heavy feeling of vomiting. You can also use heroin by snorting, injecting, or smoking. While using heroin for a period of time, studies such as white matter impairment to chronic heroin dependence show some deterioration of the brain's white matter can occur. White matter is the part of the central nervous system that directly affects your learning and brain functions, such as your decision-making abilities, the ability to regulate behavior, and responses to stressful situations. Over time, heroin takes a toll on your body in a few ways by having collapsing of veins, swollen tissue with pus, infection of the lining, valves of the heart, liver or kidney disease, and pneumonia. A form to take this drug is injecting it in your veins with the needle. A common problem is that many people share the same needle, which can lead to creating a possibility of getting HIV or hepatitis C. Injection drug users are the highest risk groups of acquiring hepatitis C infection and continue to drive the escalating HCV epidemic, researched by the National Institute on Drug Abuse. Those who have become addicted to heroin and stop using the drug abruptly may have severe withdrawal, such as muscle and bone pain, sleeping problems, vomiting and diarrhea, and severe heroin cravings. Last but not least, meth is classified as a stimulant drug, like cocaine, and has the same initial effects of increasing the dopamine in our brain and giving the user a feel of pleasure. Users get easily addicted because the high fades quickly, causing the user to binge the drug. The technical term for the user binging the drug is called run, which means they give up food and sleep in order to use the drug every few hours, and this can last up to several days. The way you can use meth is either by inhaling, smoking, injecting, snorting, or swallowing by pill. Meth has similar short-term effects as cocaine, which is increased wakefulness, decreased appetite, faster breathing, rapid and or irregular heartbeat, and increased blood pressure and body temperature. Those who inject heroin also prone to getting HIV and hepatitis C. Meth has a lot of long-term such as extreme weight loss, severe dental problems aka meth mouth, which is decaying of the teeth, intense itching which can lead to skin sores, sleeping disorders, violent behaviors, paranoia which is an extreme unreasonable distrust in others, and hallucinations. Now meth is a highly addictive drug which the user stops taking. When the user stops taking the drug, the withdrawals can include fatigue, severe depression, psychosis, and the intense craving for the drug. The amount of users has increased to an estimated amount of 595,000 compared to 2010, where the number was set to 353,000 users. Now that I have talked about the three drugs, out of the three drugs, cocaine has the most usage from the ages 26 and older, with the 16.60% in a lifetime. As a result, in the past of the year, cocaine has the highest usage rate between the ages of 18 to 25. As for heroin, the ages that have the highest usage rate in a lifetime is 26 and older. However, in the past year, ages 18 to 25 have the highest rate in the past year with a 1.8%. Like cocaine, meth is the highest rate between the ages of 18 to 25. These three drugs come with many short and long-term effects that can severely affect the body, and all are highly addictive. Thank you.